All right. Well, today is day 6 of health and wellness in the Black community. It has been such an honor to be able to host something that's historic as this, which is actually talking to people that are a part of the community that can give us advice and suggestion on how to improve our overall health. We've talked to someone from family practitioner all the way to eye care. And so today I bring to you is Dr. Keith Simmons, and he's going to talk to us about our smile and our oral care. So, Keith, thank you so much for joining us today. You definitely lay down some great gems before we actually got on live, but I would love for you to repeat those same gems to those who are in the community that are in need of oral care.
Good afternoon, y'all. Well, thank you so much for having me, and thank you so much for the this situation that you've put together. And I pray that it reaches people and is of benefit to people. But talking earlier with you, you asked me kind of some of the things that I see that are plaguing the minority community as far as oral health care and things like that. And I think one of the main issues that I see in our community is an overall fear and or distrust of doctors slash dentists, and also the stark fear of pain. They always associate, oh, I have to go see the dentist, something bad is about to happen to me. Um, you know, the reason that I think that occurs is because a lot of times in our community, we don't have access early on. Depending on the communities that we're in, we don't have access early on to dental care. So a lot of the times, your first initial contacts with a dental professional is, oh, I have a toothache. The unfortunate fact is by the time something is hurting you for an extended period of time and not going away, it's either, an extraction or root canals to save teeth. And neither one of those things are necessarily pleasant, to have to think about doing. Root canals can be expensive. Now, when I say pleasant, people always associate pain with the dentist. You should be able to go through these procedures. The only thing we can't take away from you necessarily is a sensation of pressure. So, I always tell people, if I'm pushing on you, I'm touching you, but that's just pushing on you. Now, if I'm pinching you, that's a whole different sensation. So that's another thing that I really try to do is to kind of, give my patients some information, because I always believe that information replaces anxiety. So before we do things, if they're anxious, I'll say, okay, this is pressure. Are you good with that? Is there anything pinchy? So just so they can identify, because they're just waiting for something bad to happen a lot of the times. So, I find that those are the things that, if we can get beyond that and get them to the dentist when, hey, nothing is wrong. Hey, we're just going to take x-rays, do some general maintenance. It should take maybe 30, 40 minutes. You're smiling on the way in, smiling on the way out. That's the main thing. If we can get you to that point, then the dental brand is seen in a little bit better light. But I think initially, a lot of times what I see is just that general fear, of the dentist.
Yeah. And what can someone do to, in between visits, as far as their oral health?
Okay, the most important things, and it's kind of like the fundamentals, brush twice a day and floss. As a dentist, like in my practice, my common joke is, as your doctor, I have to tell you to floss every day. Now, realistically, 90% of the population does not floss, every day. It's either one of those things. It's either, since a small child, if that was your family's routine, you have a chance, but if not, so the reality is it's going to take, about 48 hours for the bacteria to really, if left untouched, start breaking down. So I say, listen, if you can just do it 3 times a week consistently, we're going to stay ahead of it far enough. And if we can build on that, that's better. But, so that's one of the things, just the simple, brushing, flossing. And then also I like to consult people on their diet, because sometimes what I see is that people have a tendency to do things that they're not really, thinking are harming their teeth, but it can have an adverse effect on teeth, such as, soda, Gatorade. People are like, oh, I'm not drinking soda, but I drink Gatorade. A lot of these things are high in sugar. So when you sip on soda all day long, because the person that has that soda, they sip on and then they sit it down and they sip on it. And then, so basically you're exposing your teeth to sugar and acids all day long. And so your cavity rate will sometimes increase, and you're not really thinking that, because it's not like I'm, drinking anything or eating candy all day. It could be things like, soda. So, those are also the things that I try to, consult with people that I see kind of continue to have a high rate of cavities. And it appears that their home care is relatively good, but yet, they come in with these complications. But you'd be surprised how many people will walk around all day, with a soda in hand and, just sip on it all day. So, or like even candy. Some people are like, well, I like to keep a mint in my mouth all day. I mean, it's not to say that you can't have these things, but I always say, hey, get it in, give yourself your half an hour time to do those things. But after that, it's just not a good thing to constantly expose your teeth, to some of these elements.
And you mentioned too, like exposing your teeth to elements and just, in the oral care, just general oral care, what happens, and this is something that we chatted a little bit about that you mentioned before prior to us getting on, is what
Mhm.
happens when you don't take care of your teeth?
Yeah, that's a big issue because a lot of times people really don't associate how many things that your overall body ends up dealing with that is greatly affected by your oral health. And I always try to explain to people, if you eat to get nutrients inside your body, you have to put it in your mouth, right? So if you have bacteria in your mouth, then every time that you swallow, it's going, into your body. If you have bacteria in your mouth, every time you breathe, some of this bacteria is going into your lungs, and it can lead to conditions like endocarditis, which is a inflammation of the lining of the heart. So if you have, progressive periodontal disease for long periods of time, let's say you have a heart attack. Well, if your body's been exposed to that inflammation for all that time, it can actually make a difference on how well you survive, your first heart attack. Or if you're a diabetic, for instance, diabetics, they already, don't heal as well. They don't resist infections as well. Well, if your mouth is constantly in a state of infection, it's lowering your body's overall ability to kind of deal with other things, strokes. If you have bacteria in your mouth, abscesses, your brain and your skull is full of, little concavities and spaces in there. Well, if the bacteria escapes from, an encapsulated space, because your mouth is, right next to your brain. I've actually known somebody that had a long-standing tooth abscess and ended up having a stroke and was in his like late 30s. So it's a very not likely, but it's possible. And that's what I tell people. I said, don't get me wrong, it is not likely. However, if we can rule out some of these factors, let's do our best to stay ahead of that and rule out those things. So yeah, your mouth has quite a bit to do, with your overall health and well-being.
Wow. And you also had mentioned, heart diseases too. So I was
Hmm.
pretty, shocked to hear that. Oh, wow. Okay, awesome. So what else would you like to, well, first of all, where are you located? Where's your
I'm
practice?
look. Yeah, my practice is located in Chesapeake, Virginia. I've been there for 20 years. I'm a native of the Hampton Roads area. Went to Hampton University undergrad and then Howard University for dental school. So yeah, just came back home. Actually, my dentist as a kid gave me opportunity to purchase his practice. So it was a God gift situation. And yes, it's worked out really well. So I've been here for 20 years now in a private practice. So yeah, so it's
Excellent.
gone well. It's gone
Excellent.
well.
And I know yours is, and we have the link in there, like the happy visit. So what do you mean by like happy visit? Because we talked about, people having that fear. How do you ease people into having a more comfortable or a happier visit with the dentist?
Yeah, I think one of the first things, especially for my practice, is we're not an assembly line type of situation. We come in, we talk to you. The first thing I ask you, do you have any questions or concerns that you're aware of? Because sometimes, in our profession or in medical professionals, we know we have a tendency to talk at people, and we're not doing enough listening to people. Or like if you're scared, most of the time people won't necessarily come in and say, "Oh, I'm terrified." But through talking to them, after a couple of minutes, they'll be like, well, to be honest, I had this happen to me or that happened to me. So that gives me the chance to then, before we do anything, put those fears at ease because I have, a level of expectation. Like I said, the only two rules that I really have, if you have a question or concern, you let me know. And if you're ever uncomfortable, let me know. That's the only two rules we have. And once they understand that that you mean what you say, things tend to go better. And then the other thing is a lot of times when people don't necessarily like the dentist, they have a tendency to stay away. So I always tell people, if you're afraid of the dentist, the best thing you can do is to make sure that you're going at least twice a year, because typically nothing's going to happen in a 6 month period of time that we can't stay ahead of. Do you see what I mean? So, hey, we're
Yeah.
missing this area. So before it turns into, bone loss and periodontal disease, we can be like, hey, we'll get the mirror. Let me show you a technique to maybe get back there a little bit better. So, those are the sorts of things that I think once we get people healthy, because a lot of times people don't allow us to actually get them to a state of health.
Mhm.
Sometimes it's like you're doing firefighter dentistry where, okay, this is on fire, let me put that out, and you don't see them. And then they come back 2 or 3 years later. And I know you told me about this one, but now that one's hurting and this one's hurting. And the person has never had an
Right.
opportunity to actually get healthy. Whereas in my practice, I have quite a few people where, if you just look, it's exam, recall, exam, recall. There's not a lot of need for, extensive dental work. And in my opinion, if I'm doing my job, that's how it should be. I don't feel good if you're supposed to be a patient of mine. Every time you come in, something is going wrong or not in your favor. So just trying to build that rapport with people and having them give me the opportunity to get them to that point. But once they get there, it really can be a game changer going forward.
Absolutely. And just one last question, just to kind of wrap up. What, what suggestions would you give someone who is, well, I'm still not sure about going to the dentist. I hear what you're saying, but I'm afraid that they're gonna pull all my teeth out, and uh, I don't. I'm afraid. I'm scared. What suggestions would you give people who just are?
Yeah.
Yeah, because I hear it a lot. Like me personally, I love going to the dentist, but I hear it a
Uh-huh.
lot that, oh, I do not want to go to the dentist. And like I hear that a lot. And so how
Right.
can yeah, how can they ease themselves, or what, suggestion would you give someone that, is has that fear of going to the dentist?
Yeah, you know what I do a lot of times, like I'll get family members. So, usually it's funny, like the wife usually comes in first. So I know guys were supposed to be the tough ones, but what I see, they usually will, the wife will come in first if there's a question. And then, sometimes you have to drip on people. So I always tell people, like, as much as I want to say, hey, if you haven't been, come in now so we can stay ahead of it. My thing is, like, I'm not going to force you. I don't want to put that, because that's a lot of things. People don't necessarily like to be told, what to do. However, I do find that, if you just say, hey, maybe you should just go for a consultation, because a lot of times people assume that, like for instance, if you're a new patient and, if you have any major problems, anything like that, I usually don't do anything but assess everything and get you a game plan day one. Do you see what I'm saying? So they,
Yeah.
just because you walk in my door doesn't mean, oh, we got to get you numb. And, and then there's like the fear of the shots and all that kind of stuff. And I mean, there's certain techniques that we have where, the shots really aren't supposed to be, that bad. And so that's what I always tell people. It's like, if you have a bad dental experience, it's like if you go to a bad restaurant. If you like Italian, or you went to a bad Italian restaurant, you don't stop eating Italian, you just find a better restaurant. And
Hmm.
it's the same thing with medicine. Just because that's the doctor there, if that doctor is not meeting your requirements, then it's fine to go seek a second opinion or go find another doctor. So
Yeah.
I think that those are the things that I try to relate to people. Like if they say, well, they need to get in, I say, well, just tell them, just to come in for a consultation. That way they understand that, no, I'm not doing anything to you right now. You're not going to get any needles, any of that. And to your point, a lot of the reason that people have that fear, that phobia, is because that's the nature of their dental treatment. That's that firefighter treatment. Like, oh, this has been slightly bothering me. I say, well, something is slightly bothering you. If it doesn't go away in 48 hours and it lingers past 7 days, that's more than likely something that's not going to go away. However, if you're initially noticing that and you come in at that point, there's usually a relatively simple solution. Now, if you've been dealing with that sensation for a year and a half, and now the pain has gone from I noticed it to now I couldn't sleep last night, well, typically now we're into a situation where there's no simple things can be fixed, but
Mhm.
it's not the treatment that people would like to, not the easy treatment, shall I say. Do you see what I'm saying? So
Yeah.
at the end of the day, if we can prevent all of that, like if you need a little filling, hey, fillings usually take maybe 20 minutes, not that much drilling. Now if your tooth is broken off, or the tooth is broken off of the gum line and we have to take that out, yeah, that's surgery. And that's not really, those sensations, although we try to be as gentle as we can, that's not the sensation that I wish on anybody. So,
Yeah,
to try to explain to them, let's not get to that point. You know what I'm saying? And
right. Yeah.
so that's the whole key, is just trying to get them on a couple easy visits. You know what I'm saying? Or like a lot of times, if they haven't been, they might have a lot of problems, right? Well,
Mhm.
I'm the type of person where I'm like, all right, you have cavities in all four quadrants, but you know what? You have a little one right here. We're just going to start with this one so that you can go through the experience. And then when you go through that one, we can build upon those things. So, I think it's just about treating people as people. I always try to explain that, in our profession, people are looking at me in the eyes, when I'm working on them, you know what I'm saying? So
Yeah.
you have to treat the person like a person. You can't treat a person like a car. You know what I'm saying? Like,
Right.
it's
Right.
the difference. We're not mechanics. You have a person that has feelings looking at you in your space, treat them accordingly. So,
Mhm.
those are the sorts of things I just hope everybody can kind of get the hands of a great doctor. There's a lot of them out there. And just get to the healthy side of things. And then I think once they get there, they'll be motivated to stay there because it's way less expensive, way less extensive nature of treatments. Do you see what I mean? And then the other reality I try to tell people is, because I just get false teeth, or I see the commercials on TV, I just get these things. And I try to explain to them, like, okay, dentures, to have all your teeth removed is going to cost, indentures is going to cost you thousands of dollars, not a thousand, but thousands of dollars. If you want the implants, they're 30 plus $1,000 usually an arch. So, like, if you need your whole mouth fixed, it's going to cost you well over 50 to $60,000. That's the nature of the treatment. So it's actually cheaper to keep what you have and to keep what you have healthy. So that's the other thing I try to tell people too, because they see the commercials like, oh, I want implants. And then you say, yeah, that implant is $4,500 for the one tooth. And then, it's like, oh my God. And yeah, but that's just the reality of things. So, I'm like, if you had that kind of money, you'd be better off taking a trip somewhere. You know what I'm
Right.
saying? So,
Yeah.
you
Yeah.
know, use it for that. So yeah,
Right.
healthy is
Absolutely.
best. Healthy is
Yeah.
best.
Absolutely. Well, thank you so much, Dr. Simmons, for joining us today and just sharing with us what we can do to improve upon our oral health. And the first thing is first is at least go in for a consultation. That won't hurt. They won't be in your
Absolutely.
mouth. Yeah, absolutely.
Exactly. Yeah. So that's the best way to phrase it. If somebody is a dental phobe, just say, hey, just go in, tell me you want a consultation. Don't tell me you have a problem. Don't, just say, hey, and they'll put you on the books, sit down, talk to you. You don't have to worry about anybody doing any treatment. And then, if the personalities match, then you kind of go forward. If they don't match, ask your friends. Ask a friend, like you said, that you love the dentist, because I don't do advertising. Virtually all my advertising really comes from word of mouth from patients. But I always have a steady stream of patients, because if there is a person that's treating people a certain way, you know, the people don't mind telling you, you know what I'm saying? So
Right.
it's like, hey, if the other person wasn't right, ask somebody like, hey, call Ya. She's happy she goes. Who is your dentist? You know what I'm saying?
Right.
So that's another reality. Like, hey, that's kind of what it is. So, but yeah, that would be the suggestion. Just tell them to go in for a consultation. That's a very good way to break the ice. And then
Mhm.
hopefully, if the other personal side of things works out, between patient and provider, that's how you build a good relationship. So I would say start there and look for those things.
Absolutely. Well, thank you so much for being a part of this today.
Absolutely. And thank you so much for what you're doing. And it's awesome. And much continued success to you, man.
Absolutely. Thank you.